Hey guys, it's Holly and Jess from Highland Family Planning, and we have been getting a lot of questions about birth control and infertility. So we're here to address all of the myths and get you straight with all of the correct information.
First of all, some people might be wondering what's infertility or sterility. Those are some big words that mean something pretty simple. Just means that a person is not able to have a child. So if someone's infertile or if they're sterile, they're unable to have a child.
So a lot of people are wondering, is infertility actually a problem in our country? And the answer is, yes it is. About 12% of women in the United States, ages 15 to 44, will have difficulty getting pregnant or carrying a pregnancy to full term.
So a lot of times when we think about infertility, we're thinking about problems that lie with the female partner. But actually, 7.5% of male partners under the age of 45 have actually gone to a fertility doctor to check and see if there were any issues with them. And of those 7.5% of men, 18% of them have actually been diagnosed with issues with their fertility.
So I think it's really important to look at the stages of pregnancy happening so that we can really understand where the problems might be lying. So the first thing that needs to happen is a female needs to release an egg called ovulation. Okay, so if a female isn't releasing an egg, that could cause fertility problems. Next, the sperm needs to get inside the egg and fertilize, fertilization.
And they're quite adamant about it.
Yeah, like that's really all they know how to do, but sometimes sperm may not have the lifespan to get to the egg. Sometimes they go the wrong direction. Sometimes just the timing doesn't work out.
And sometimes there's just not a lot of sperm.
Sometimes there's a low sperm count. Also, a fertilized egg needs to travel through the fallopian tube and attach itself onto the uterine lining and then start to grow from there. So if any of those steps are not happening or get interrupted in some way, then infertility issues can occur. Besides issues with the reproductive system, both male and female going on, what are some other things that could cause infertility? One of those things could be age. As a woman gets older, she stops releasing as many eggs. She also doesn't have as many eggs left, and some of the eggs that are left may not be as healthy as they were when she was younger. Another thing that could cause infertility is smoking. Women who smoke could have issues with fertility. Excessive alcohol use, extreme weight gain or weight loss, and also stress, emotional stress and physical stress on the body.
There are some causes of infertility that are really preventable. Chlamydia and gonorrhea, for example, are two sexually transmitted diseases that are curable with medicine as long as they're found in time and treated. They're curable. However, if they're not treated in enough time, they actually can do a lot of damage to the reproductive system. If untreated, 10 to 15% of cases of gonorrhea or chlamydia will lead to pelvic inflammatory disease in women. Pelvic inflammatory disease and other infections that can be caused by gonorrhea and chlamydia can cause infections in the upper genital tract, which can leave permanent damage to the fallopian tubes, the uterus, and the tissues surrounding the female reproductive system. It's also important to know that chlamydia and gonorrhea they're both sexually transmitted diseases that can come with no symptoms. It's really important to know what your status is so that you can prevent these diseases from going untreated and causing long-term to permanent damage.
Yeah, absolutely. It's really important to note that of all the research that we looked through, not one piece of information stated that birth control can lead to infertility. Okay, a lot of people get confused, and I think a big part of it is because we all assume as women and as young men that we are fertile. And when women start using birth control and then they stop to try and have a baby, they automatically assume that it was the birth control that led to the infertility. When in fact there were probably other factors, most likely a sexually transmitted disease, but it could be a lot of other factors. If you and your partner are concerned about fertility and what may be causing your infertility, it's really important that you guys see your doctor and get tested for conditions, health conditions that may be going on with you and or your partner. We're really excited that this question's been brought to us and we've been able to answer it. If you guys have any more questions you'd like us to look up the answer for and report a video on, please comment below. And don't forget to subscribe so that you can stay up to tune with all of our videos.
See you next time.
Bye.
Thank you for watching today's video. If you have any comments or questions, please post them below. And don't forget to subscribe. See you next time.